That newborn, in my arms, and that we fight so much before thinking that she was not going to be born, and then suddenly she just, had to go for a heart surgery. It's like, why? Why now, this news now? After she was born, we took her for her pediatrician, Dr. Denise Serafin. She was following up and she saw that her feet was too cold and she decided to, go further. We took her to the cardiologist, Dr. Ramos. From Dr. Ramos' office, he told us what was wrong and then to meet with Dr. Chai, which was the surgeon, the next day.
Isabella was born with a congenital heart defect called hypoplastic aortic arch, which is a condition where the aorta and the aortic arch is too small to sustain life. So she needed to have an operative procedure to correct that, which involves enlarging the aortic arch with a patch.
My only question was, if one of your kids have the same problem Isabella have, you will do the surgery or you will give it to someone else? He told me, no, I do it. I know how to do this and I do it for my daughter too. That was my only question.
To be there at the hospital and hand that little baby to the nurse and that door closing, my husband almost passed out. He was being so strong, but at that point the nurse had to hold us because we almost passed out. Was just that feeling of just giving her away, not knowing, is she coming back? The nurses were coming every hour or so telling us she's doing okay, everything is okay, she's doing okay. So when they were done, we were like, okay, they told us she's fine, surgery is done. For us, was just, everything was so negative and the end of the world, oh my gosh, the surgery. And the nurses were they were so sweet, all the personnel and everybody was so sweet. And they just told us, we know that she's going through this, she's a fighter. So we just kept that in mind and people were asking us, how are you able to manage all this pressure and these things? And we are fighting for her. If she's fighting, we are right beside her fighting for her, The total time that we spent in Tampa was about 3 months. We spent 3 months. Being away, not being able to have all this done in Orlando was just crazy that we had to go to Tampa for that. We are so glad to hear that Florida Hospital now has, their own people here, and future Isabellas or future babies like her will be able to be home, to be in Orlando, and for the family it's going to be much easier. We're so excited, so happy to hear that.
The development of Florida Hospital for Children's Pediatric Cardiovascular Program is going to be a quantum leap improvement in the quality of care for children born with congenital heart disease. For starters, children like Isabella will not have to go and travel to another city to have their surgeries performed.
We definitely trust Dr. Ramos. We love him. I mean, he's still the cardiologist for Isabella now, and he was so supportive and he helped us out with every single detail that we had, even now. And we definitely trust Dr. Chai as well, and his staff also was just a great team. We really feel supported by all of them. Even with all this, there is light at the end of the tunnel, so she's perfect, she's fine. She's still under physical therapy, speech therapy, all those therapies, but she's a normal, regular baby. If you see her, you cannot tell that she had any issues at all. You cannot tell everything that happened with her. She's a normal baby, so playful, so hyper. She doesn't stop a minute, and she's just great. And we're just so happy to have her around and the way she is right now.